Hello, I'm Dr. Peyman Saadat. I'm the medical director of Reproductive Fertility Center in Southern California. I've been in Southern California for the last 40 years. I went to school at USC and did my fellowship at the University of Southern California. And then I founded and opened my own practice called Reproductive Fertility Center. We do catering to all kinds of fertility patients, including patients that did egg donation, surrogacy, surgery to fix their uterus or tubes. We also cater to male factor infertility for men that have low sperm count. We also do any other kind of fertility related treatment.
Hello, Dr. Saadat.
Hello,
Nice to meet you. I'm Amy.
nice to meet you.
Looking forward to hearing more about you and your clinic and all about your practice. So I have to ask, because this is always an area of curiosity for me, what made you choose this specific area of fertility?
Oh yeah, so when I did my residency in OBGYN, we rotated through fertility. And then when I saw the happy looks of the people that got pregnant after trying for such a long time and they achieved their dream, I decided that's what I want to do for the rest of my life.
Oh, I love that. Okay, thank you for sharing. So, what areas of fertility treatment do you primarily specialize in?
So I do all aspects of fertility, including egg donation, surrogacy. We are also doing sperm donation, regular IVF, any surgeries related to fertility. For example, if someone has a problem with their uterus, like fibroids or polyps, we fix those. Any problems with the fallopian tubes or any problems with the sperm count, we work with doctors that do sperm extraction from the testicles directly. And any other fertility issues that you can think of, we take care of them.
So you wouldn't say that there's one area particularly that you do a little bit more of?
And so if you want to break down, I do 50% like regular IVF for couples that are unable to get pregnant. And then the other 50% I do egg donation and surrogacy. So like I said, I've been doing this for 20 years. I'm experienced in all aspects of the fertility process, and I've been doing all aspects for the last 20 years.
Amazing, thank you. So would you share a bit about your medical team and how care is coordinated for patients?
Sure. So the medical team, I'm the only physician, so I do see all the patients myself and review their medical treatment plan.
Nice.
And supervise every aspect of their treatment, including like their medication dosage, monitoring with ultrasound their blood test results, and doing the egg retrieval, embryo transfer, seeing the surrogates and the donors, all of that. But we do have a team of about 20 to 25 people in the clinical side, including nurses, coordinators, financial people to discuss finances with the patient. And then in the laboratory side, we also have a very dedicated team. Our embryologist is Yolan Zhang. She's been doing this for about 30 years. She's a CAP inspector, meaning she inspects other labs to make sure everything goes by the book. She's well known in the fertility business and she's very successful. That goes to our success rates in our clinic.
Oh, nice. So approximately how many IVF cycles does your clinic perform each year?
So we do approximately about 500 retrievals, and then like most of them end up in a transfer, but some of them end up like having 2 or 3 transfers. Some of them just do egg freezing or embryo freezing for future use. But about 500 cases a year.
That's amazing. What would you say your current success rates are, and what factors do you feel most influence those results?
So I feel that our clinic is unique and has a very high success rate because I do all the treatment monitoring and the egg retrievals myself. So unlike like the big clinics, we have a boutique clinic where the patient is kind of seeing one person at all times. that helps with decreasing the stress because they know the person, which is me. And then in addition, like I said, we have our embryology team, which is very good and experienced. And then based on those two things, getting the treatment from one person and going through the treatment with the embryology team, which is very experienced, and also myself, I've been doing this for 20 years. So I'm also very experienced in IVF and fertility treatment. We have a very high success rate.
Do you do everything here? So I know your lab is downstairs, so are all like the frozen goods here?
Yeah, so everything, all the clinical visits are done in the clinic, either here or in our corona office. And then all the procedures are done in the same building on the lower floor, where we do the egg retrieval, embryo transfer, any surgeries that are necessary, sperm extraction, or any other treatment that's necessary.
All
One-stop shop.
That's nice. Wonderful. So how frequently does your clinic work with egg donation cycles?
So our egg donation cycle comprise about 25% of all the IVFs that we do. So we do around like 100 egg donors a year.
Wow.
So, and I've been doing this process for 20 years. So we are very experienced in dealing with egg donors and surrogates. And then, like I was saying, I see all the egg donors, even myself. So the egg donors also, which are important, feel more comfortable and do a better job when we see them individually.
Yeah, that must be so nice to like know every single patient and know kind of where they're at, and just having them, like you said, there's so many steps to the process, and this process is very long, right? So for it to have one person who's the doctor managing your case must make your patients very happy. What is your clinic's approach to screening and preparing gestational carriers before the embryo transfer?
So gestational carriers are an important part of our treatment plan. We want to make sure, first of all, they're comfortable, but we also want to make sure that they are good gestational carriers for our intended parents. So before they come in, we review their medical records. If there are any issues like that we need to discuss either with the carrier or the intended parents, we try to address those up front. So when the surrogate arrives at our clinic, they're ready to move forward and the process goes smoothly and quickly. So the process starts with me reviewing the medical records, make sure they're a good candidate to become a gestational surrogate. Then we have the surrogate come in for an appointment. During the appointment, we do some examination, including checking their uterus to make sure it's clean. And then we do blood tests to make sure they don't have any infections or anything to pass to the baby. We check their vaccination to make sure the vaccination is up to date for pregnancy. We also check to make sure the drug and alcohol screening is negative, because we don't want them to use any drugs or alcohol during pregnancy. We also send all surrogates for psychological screening to make sure they're psychologically stable to become a surrogate mom. Once they pass all those tests, then we have them do a legal contract with the intended parents, and then give them medication to prepare their uterus and transfer them.
Perfect. Yep, sounds pretty standard.
Yes.
So I know there's so many different steps, but is there any specific medical criteria that you might prioritize for surrogates to ensure healthy outcomes?
Sure. So the best criteria, if somebody has been a successful surrogate before, that's already a good sign, because they know how to use the medications, we know their uterus works. But other than that, what's important is, like I said, we just want to make sure all the surrogates are healthy, they don't have any major medical problems. We want them to be under 40 years old. And we also want to make sure they had at least one successful pregnancy to full term without any complications. And then other than that, we just do the medical screening to make sure the uterus and the blood work is okay. And then as soon as they pass those, they should be okay to move forward.
This is like a question of my own, since I was on intake before. So I know a lot of times, like every surrogate, like you're never gonna have someone come in that just is like this perfect, right?
Correct.
So how often are you, like, in your opinion, consulting parents to be a little bit less stringent with their own expectations of, you know, because a lot of parents will sometimes hold weight to things that may not medically matter, you know what I'm saying?
Right.
But like how often do you feel like that's part of like your consulting process? It's like kind of convincing parents to say like, this is what's important, let's move forward with this one, or do you kind of let them?
So what I do once I review the medical records, I review that with the intended parents, and then we tell them like what's important and what may not be important. For example, I just had a surrogate that during pregnancy she used cocaine. So right off the bat I said I can't use that surrogate. But I had another surrogate this week that at the end of the pregnancy her blood pressure went up a little bit, which is very common. So I still discuss that with the surrogate and also the intended parents. But I told them it's probably not a big deal. We have to just keep an eye on her salt intake and make sure she's on baby aspirin so she doesn't get like pregnancy-induced hypertension. So it's case by case, but we will be open to both the surrogate and intended parents to make sure they know all the ins and outs.
Right, and they're comfortable with
the process.
Yeah, okay, good to know. So let's talk a little bit about you personally.
Sure.
You were mentioning, what are your favorite hobbies that you do outside when you're not working?
So yeah, I have 2 kids, a son and a daughter. I like playing basketball with them. That's one of my favorite hobbies. Other hobbies, obviously, going on trips. I love going on trips with my family. That's a lot of fun.
What's been a favorite destination?
I like going to Fiji. I went to Fiji a couple years ago. It was really nice and relaxing.
Is that where there's like huts on the water?
Yes. We went to this private island where there's only like 10 rooms.
Oh, wow.
It was very relaxing. Nobody there.
Oh, that's nice. You're like, don't bother me. What made you want to study medicine?
So I come from a big family of doctors. I have 2 brothers. One of them is a plastic surgeon. The other one is a dermatologist. And I have a sister who's an optometrist.
Wow.
And then also from my wife's side, she's a dentist. So we value education in our family, and I really like helping people. So that's one of the main reasons.
Lovely. Your parents must be very proud. It's like every parent's dream is like, every kid of ours is a doctor. And did you meet your wife at USC also? Because I know they have a big school of dentistry.
She did go to USC, but I met outside in a party.
Oh, okay. What would you say the favorite aspect of your job is?
The favorite thing for our kind of business is calling patients with a positive pregnancy test. When we talk to them and give them the good news, it's amazing to hear their voices. Some of them cry, some of them laugh, jump. It's very nice.
That must be so rewarding.
It's the best.
Is there a least favorite aspect of your job?
The opposite, obviously, when we call someone that was unsuccessful either because their embryos are not normal or they did a transfer and it didn't work, it's heartbreaking. But at the same time, the good news is we can always console them and tell them other options that they have. So it is heartbreaking, but at the same time, it's something that must be done.
Yeah, and I'm sure by now there are options always.
There's always an option.
There's always, yes, which is so nice.
Yes.
Advice to intended parents who are just starting the process.
Well, the main thing is to start, for intended parents that want to become parents, the main thing is to first start talking to a specialist to see if there is anything that needs to be done. For example, some patients need to go on supplements. Some need to go off some of the medications they're taking. For example, if somebody's taking testosterone, a man that's taking testosterone, that will decrease or make the sperm count 0. So they need to go off testosterone before they start. So the first step is to talk to a specialist to make sure they review all the records and their history and give them advice as to what to do. And then the second part that I advise is if you want to become a parent, don't wait too long. Some people wait like for a long time before they consult with a physician. The younger the person is, obviously, the better the success rate. In our clinic, we had the oldest patient that became pregnant with her own egg is 46 years old.
Okay.
And then with the egg donor, the oldest is 62 years old. But don't wait that long because...
Wait, someone donated eggs or needed an egg donor at 62? Okay, got it.
So our advice is don't wait till you're 62 or 46. The younger you are, the easier it is.
So consulting with a specialist, meaning someone like you, correct?
Correct.
So at what point, right? Because some doctors have like a, don't come to me until you've been trying for at least a year yourself. So at what point would you recommend you should probably go see a specialist?
So the point you need to come depends on the person. The younger you are, the longer you can wait. For example, if you're under age 30, it's okay to wait like 6 months to a year. But if you're 40 years old, we don't advise to wait for a year. So it's patient by patient, but my recommendation is if you're in doubt, at least do a consultation. You won't lose anything. And then after you talk to the doctor, if they feel like you can still wait for a while, if they tell you the truth and you wait for a while, and if they think that you should move forward, then you move forward.
Yeah, that's good advice. I know, because I have friends who experience infertility and they're like, oh, our doctor won't do anything because we haven't been trying for at least a year, like whatever. So I know every doctor is different.
Right.
How about for surrogates? What advice do you have for women who want to become surrogates?
Well, it's a very noble thing that surrogates do. If they're up to it, we also want them to feel comfortable and make sure they know the ins and outs of surrogacy. So again, it will be good to talk to your agent or the team that's taking care of you so they can explain to you what the surrogacy process involves, including how many visits, what medications you need to take. But also, if you feel more comfortable, you can also talk to the physician that will be taking care of you and they can review the process.
Perfect. Okay, a couple more fun questions just to get to know you. We talked about your favorite travel place. What is your favorite type of food?
Oh yeah, I like all kinds of food, unfortunately, but I like sushi a lot and also Chinese food and Persian food. Those three.
So, okay, yum. And I love Persian food. What would you recommend in Beverly Hills here for sushi?
For sushi, there is a place called Koi on La Cienega that's pretty good.
Have you ever been to Sugarfish?
Sugarfish too, yes.
I love Sugarfish. There's a Sugarfish here, yes?
Yeah, on Beverly Drive. Yeah.
So good.
My
So
daughter
good.
goes there all. It's really good.
I'm obsessed with that.
GSHC.